everyone. Thanks for joining us for lunch today. My name is Allison Pierce. I'm a member of the Fairfax County Health Department's communications team. And today we are broadcasting from the parking lot of the new Grand Mart in Alexandria, where our mobile lab is today, offering COVID-19 testing. Testing is free. We are offering both rapid and PCR tests. So if you have COVID-19 symptoms or a known exposure, we really do encourage you to go ahead and get tested. This mobile laboratory unit has really made an impact throughout the community during this pandemic. And here to tell us more about it is Deb Severson. Deb is the director of our laboratory services for the health department. So Deb, tell us, what is a mobile lab?
Thank you, Allison. Well, we acquired the mobile lab in May of 2020. And as you can imagine, at the outset of the pandemic, public health labs as well as labs across the nation had to quickly reassess our strategy for new methods to address our testing capacity to meet the needs of our COVID testing. The ability to take our testing out into the field allows us to immediately identify positive individuals. It allows us to provide them access to care quicker, ultimately reducing the spread of disease in our community, as well as hopefully increasing the health of our community as well.
So I have to assume that this mobile lab unit put quite a few miles on during the course of the pandemic. Could you give us a sense of just how many tests have been performed out of this unit?
Sure. As I stated, we did acquire this lab in May of 2020, and we took it out between 2 and 3 times every week. We took it out to long-term care facilities, assisted living facilities, but also to large community testing events. At each of these events, we were testing between 200 to 300 individuals for COVID, and we were providing rapid testing as well as our RT-PCR testing that is performed in our laboratory.
Wow, so 2 to 300 COVID tests per event, multiple events during the week at one point in time. That is a lot of effort on behalf of the team and on the mobile lab unit itself. So, give us a little bit of history here of the mobile laboratory. Like, what is its purpose?
So the mobile laboratory originally was purchased by the Fairfax County Fire Department after the 9/11 and the anthrax event at that time. It was purchased to position us to respond to emergencies or bioterrorism events in the future. So once we found out that the lab was available, we quickly they loaned it to us, and we have been using it ever since for the pandemic. It ultimately has provided us the ability to not only collect our specimens on site, but it also provided us the ability to perform the rapid testing, which really cut the turnaround time for testing dramatically. When we perform testing inside at our laboratory, it's about a 72-hour turnaround time. But when we bring it out in the field with our rapid testing, we can provide those results within an hour.
Wow, so the mobile lab really came about as part of emergency preparedness efforts that the county undertook. And, it's interesting, when we think of first responders, we always think of our wonderful fire department and police force who are out there all day in the community responding to emergencies. Public health has been in a first responder position, too, throughout this pandemic.
And typically, public health individuals, our public health nurses, our laboratory staff, our emergency response people, all of the public health employees are first responders, but we are typically behind the scenes, and no one knows the work that we do until an event happens and it becomes an emergency when we become visible.
Right. So also, it is Public Health Laboratory Week, and we can see that Deb is wearing a wonderful celebratory t-shirt today. One of our public health laboratory scientists designs these every year for the team to get in the spirit. So when people think of a medical laboratory, we think of the places we go to for blood work or for allergy testing. But what does a public health lab do?
So the main difference between a public health laboratory and a clinical laboratory is that in our hospital settings and our reference lab settings, they're dealing with acute care. So you go to the hospital when you're sick. You want identification and diagnosis of your disease state. With public health, we're looking at disease state of the community as a whole. So we're doing more surveillance. We're doing a lot of communicable disease testing that's reportable to the state to prevent these pandemics that we're in today.
Oh, wow. That's great. And we thank you for all the work that you and your team have been doing. And I have to say, I'm a member of the health department team, but I also was a client of the mobile laboratory unit a couple months ago. I had some symptoms and got tested for COVID-19, and luckily it was negative, but it's a really wonderful, very convenient, very easy thing to do to come out today if you do need a test. You can find more information on our website about where the mobile health laboratory will be. And that website URL is fairfaxcounty.gov/COVID-19. You'll see testing is pinned right to the top of that page. And if you go to that page, you'll see information on the mobile lab and where it's going to be. Again, it's here at New Grand Mart in Alexandria until 3 p.m. today. It's windy and it's sunny, but it's a great day to come out to get tested if you need to. Tomorrow, the mobile health lab will be at the Richard Byrd Library in Springfield, and you can find other information about where it will be in coming weeks on that website. Again, that's fairfaxcounty.gov/COVID-19. And I would like to say that Deb has been on the front lines of serving the community in this pandemic for upwards of 2 years now. She's one of the many amazing colleagues at the health department. So on behalf of the entire community, thank you for all the service and all the great work that you and your team have been doing throughout the pandemic.
Thank you, Allison. And I'd just like to say, if you know a public health laboratorian or a laboratorian, please tell them thank you for their service. This is National Laboratory Professionals Week, so we appreciate everything they all do. Our team is awesome.
And I can actually vouch for that too. They are a wonderful group of people. I'm seeing that we do have a question that has come in, and it is about today's service. So, Deb, the question is, what can a person expect if they come out today to get tested?
So if the person is symptomatic, we would perform a rapid test on them as well as a routine PCR. The rapid test results, if they wanted to wait around, would be available to them within an hour. The RT-PCR would go back to our laboratory for further testing, and that would not be available for 72 hours.
Okay, great. And you can see more tips for attending one of our mobile lab events on our website. And you can see there what you can expect, how to prepare for your visit, and so on and so forth. And all of that information is there. And seeing as we don't have any more questions, I think we're going to wrap up our lunch broadcast today. Again, if you need a COVID-19 test, the health department is at the New Grand Mart in Alexandria today until 3 p.m. Come on out and get tested. And again, happy Public Health Laboratory Week to Deb and to the entire Public Health Lab team at the Fairfax County Health Department and across the country. Thank you for joining us today, and have a great afternoon.